remember there was a point there when early days and I was a speaker, a nutrition, another dietitian potentially pulled out of a conference last minute and they asked me to come and present. And obviously I had nothing prepared and I was extremely nervous. There's going to be about 200 nurses there that I had to present in front of. But I took it up and did it. And from there, I then come back every year and presented at that very same conference. Met all of the nurses in the area pretty much, or was able to expose myself to the nurses. So never pass up an opportunity to speak, particularly to your referral base. Welcome to How to Build a Profitable Nutrition Business. If you love nutrition and you love helping people and you want to be in the game long enough to keep doing that, then this is the podcast for you. Let's get into it. Today's episode is all about marketing, and it's the marketing strategies that we used in our business that helped us grow to a seven-figure business over a very short period of time. When we started our business, it was just me essentially for the first 6 months. We had 3 kids, almost under 3. So my wife was busy being a mum at home, and I was just head down, bum up in the trenches, seeing as many people as I could. I didn't have the brain capacity to think of marketing strategies. It was just trying to get by each day and survive. Thankfully, my wife, who has a marketing business background, she stepped into the business after about 6 months, and with her expertise, we were able to implement further marketing strategies that help grow our business. And so I would like to dedicate this episode to Angela Taylor. So Angela is a mentee of mine. She's in her first year of running her dietitian business, and she suggested this episode to help think about those marketing strategies for those sole practitioners that are working really hard and probably don't have the time or the space to allow their brain to expand and think about what marketing tools they could use. So if that's you and you're interested in learning about all the marketing strategies that we used, I think there's about 40 that we've used, then tune in. This is the episode for you. Thanks. Welcome back to another episode of How to Build a Profitable Nutrition Business. And today I'm joined by one of our favorite guests, my wife, Stacey Hughes, the marketing extraordinaire behind our dietitian business, because as a dietitian business, there was a lot of strategies that I think we used that were quite effective to grow our business. So we were chatting about this morning, and I think there's 2 types of marketing targets, and one were those referrers and the other were from the public. Stace, I think that when we started, like, it was essentially doctors' meetings, wasn't it? The doctors get paid for referring to us, so there's really a win-win there for us. And so we would just have meeting after meeting. Each week I'd be out meeting with a new doctor's practice, just trying to network and build up that clientele. And over the space of 8 years that we were in business, we had the 200 doctors' practices, I think, on our list. Multiply that out by number of doctors, and we had quite a referral base that was coming from there. And those doctors' meetings were quite successful, wouldn't you say?
Yeah, and putting on lunch, that was really good. So even if the doctors were busy and they couldn't attend, it appealed to them if you went there with some sushi platters or Subway platters, that they would come in, grab something to eat, and then maybe meet you or one of our other dietitians and have a chat as well. So even if they weren't there for the whole presentation or the whole time that you were there, having that lunch as a carrot really got them to come and meet you.
Yeah, sometimes it was demoralizing. You'd actually go there and not talk to a doctor at all.
Yeah.
You know, or they'd been there, who are you? What are you here for? Okay, I've got to go. So whereas other doctors' practices, you'd have a captured audience and it was great, and you'd talk to them. And we used to take our scanners and the indirect calorimeters just to show some of the features and services that we offered. And you just had those really good conversations, and some doctors were lovely and others were not, but that's okay. That's just the nature of it.
But it's just something you just persevere with. And like you said, it really was worthwhile having that many doctor referrers for us in the end.
Yeah, I think the best avenue for us was when they would have doctors' meetings or professional development meetings and offering to put yourself out there, because I think it's easy to assume that doctors are experts in everything, but they're not. And if you offered to do an update on nutrition advice around lowering cholesterol, it can be a little bit hot topic, if you like. And so being able to present on something like that would usually capture quite a few doctors. I found that to be quite successful. So yeah, it was quite good. Even the nurses are. Most of the referrals are coming from a practice that's got a chronic disease nurse. So really building that relationship with them and meeting with them regularly was really important. We also do like a research update. I would do a video and send out a research update to a lot of the nurses and doctors And it was quite often the nurses that would give me feedback on that. And I found it really interesting, whether it was iron supplementation schedules or the latest research around diabetes and nutrition or whatever it may be. And it just kept you at the forefront of their mind. Yeah. What other stuff can you remember that we did, Stace?
We used to have a healthy food guide subscription that we would send to all the practices. So I think at that time, maybe there was about 15 doctor practices, and we used to send it with a card or a letter, and we'd also put a sticker. So I'd order a whole heap of healthy food guides. That's like a magazine with heaps of healthy recipes for them. I guess this was pre-COVID, before when they were allowed to have magazines in their waiting room. And we'd stick a sticker on the front too, something about with compliments from CQ Nutrition and our details. But yeah, the nurses, we get great feedback from the nurses too, wouldn't we, about that? I guess it's like that kind of lumpy mail tactic as well. They're getting something that's not, yeah, I guess it's something of interest. They're getting a magazine that's quite informative and entertaining that they can put then in their waiting room as a gift. So yeah, that was a really effective one.
Yeah, so it was costing us like, let's say, $60 or $70 a month. I think
Yes.
that was a bit of, which is why we probably didn't keep doing it. But yeah, I think it was a unique gift and way to build brand awareness early on. I think that worked quite well. We also did posters up about what we do. I think it's easy as dietitians, you get pigeonholed into weight loss or whatever. And so the DAA actually had a really good resource that we utilized and put our branding and everything on it and added to it and whatever. And it was all of the conditions that we could help for. And I had many conversations with doctors over the years because it's there in front of them, it was on their desk, and they're like, I didn't realize that this is something you could help with. And particularly now around the mental health space, there's so much that nutrition can play a role. And so keeping that in front of the doctor is really important.
Yes, and even just rebranding different resources and things like that that we could give to the nurses or doctors that then they could give to their patients.
We talked about that, like if we're doing that again, is to create like a infographic and you could co-brand it with your best referring practices, couldn't you? That would be a pretty cool feature. And it would give the clients just an initial insight into the services and your expertise and what you could offer. But as long as it was providing value to them, and it's a win-win for the doctors because they've got nothing to lose. It's just adding value for their clients and putting their brand on it. So that's something that has real merit that we could do.
Yeah, because now you have things like Canva, tools like Canva, which are easy to create. And there's AI tools built within Canva as well that could create some really awesome infographics, things that you could get printed out quite cost effectively from Vistaprint or places like that, and then give to the referring partner to give out.
I think about our resources now, like we thought they were pretty cool at the time, but
Because we had a color printer, but yeah.
now that Canva, yeah, it just blows your mind what you could do. Now, we were established at the time that the eating disorder care plan came out at the back end of 2018, I think it was. And it was very new to the doctors. They, like anything new, there was a bit of onboarding. And so we took it upon ourselves to become the local expert. And there was a downside to this and an upside, is that we built a really big referral base off the back of it was the upside. But the downside was that I almost become a hotline for all the nurses and doctors doing these care plans, wanting to know what to do, how do we refer, blah, blah, blah. And so you were often on the phone for no remuneration, just helping them do these referrals. So we end up building an online calculator for screening tools and going through some of the questionnaires that could help them then refer a client on. And that was quite useful. If you're half handy at tech, it's a really good idea to just, how can you make it easier for them to refer? So an online calculator, particularly what you can do now with AI, it's something that probably could invest in and advocate to your referrers.
We also used to do a pre-appointment form that this is when we first started. This is probably one of the first things that we did, and we had them printed out in booklets. So it was a pre-appointment form, and we gave every referring practice a booklet, didn't we? And then it's something they could tear off. And we were still getting those years later too, weren't we?
Well, to the point where we were trying to move away from them to
Yeah, we
online, trying
wanted
to get
online.
doctors to move online, and there was resistance because they love that little pad, but they just rip it
Booklet.
off give it to the client, and the client would bring it along. And so they actually would scan it. I had many nurses say to me, care plan nurses, so that they would scan that and put it in the client's file because there was a lot of useful information on there that they could use. So it was that was a good tool. But yeah, now with online doing it that way, I probably wouldn't worry about it. But
Wouldn't worry, yeah, because you do use QR codes now to go to some sort of online form,
yeah.
which would be better to use. But yeah, that was another tangible thing that people like to use.
Speaking at conferences was another really big one. I remember there was a point there when early days, and I was a speaker, a nutrition, another dietitian potentially pulled out of a conference last minute, and they asked me to come and present. And obviously, I had nothing prepared, and I was extremely nervous. There's going to be about 200 nurses there that I had to present in front of. But I took it up and did it, and from there, I then come back every year and presented at that very same conference, met all of the nurses in the area pretty much, or was able to expose myself to the nurses. So never pass up an opportunity to speak, particularly to your referral base. And then the other thing with us too is that doctors were a big part of it. We didn't invest too much in this, but other allied health practitioners can also be another referral source. We did have meetups and certainly collaborated with other allied health professionals, but the key thing for me was that the doctors get paid to refer to us.
They were the ones to concentrate on, wasn't it?
It was, yeah. Certainly not neglect other allied health professionals, but in terms of where that's going to go, like it was important to invest your time, whether there's going to be a return on your investment.
Yeah, creating those relationships with the nurses, which we've spoken about. And sometimes that might mean making them bringing coffees for them, or creating some sort of staff training that you could do for them. So yeah, just always being in the forefront of their mind as well.
And that forefront of their mind was something that we tried to think about constantly with the gifts. We never did mouse pads, but we're always thinking, okay, what is there on a space or desk that we could do that we're there reminding? And I've seen exercise physiologists do this well, like correct sitting techniques for posture and things, which I thought was quite clever because it's right there for the doctors to use. And so I'm thinking, like, if you're doing sort of infographics that they could hand out to clients, or I love the idea of, we didn't do this moving forward, doing a new nutrition business, I'd do this where you would do a client journey case study.
Yeah.
Now, whether that was a video format or just a little one-page document, if the client has been diagnosed with diabetes and they come to see us, this is the process that they may follow and the outcomes we'd expect. Yeah, I think that would be quite useful. Whether it's a booklet or video, like it's got to be the easiest format for whoever's receiving it. I'd probably collaborate more with pharmacies as well, like some sort of lead magnet or something within pharmacies, because most people are going from the doctor to the pharmacy, and there's a real nutrition focus at pharmacies. So doing something like that, or doing like an ebook now, like with something like Mealzee, you can do recipe ebooks that you could do that as a free lead magnet where clients could get a free customized recipe ebook by scanning a QR code at the doctor's surgery. And then it's branded as yours. And then there's information within that recipe ebook that's all about your business, and they can book an appointment and everything. The way we've got the features set up in the recipe ebook. So there's a lot that you can do, like in terms of marketing. When I was thinking about this podcast, I'm like, oh crap, what did we do? We didn't do that much. But when you sit down and think about the 8 years of business there's a lot that we did do. And then there's so much more you can do now with the tech that's available. Now, what about the public? So you've marketed your referrer base. What about now targeting the public? What did we do that worked well?
Yeah, we obviously had a website, and we'd had a WordPress website from the very beginning. And to amplify it, we had the SEO optimized blogs. So you would write blogs. This is obviously before AI, so it wasn't as easy to do. You would create blogs and we would upload them to our website. So yeah, our website was actually really good SEO optimized. And I'd done a few courses as well around that, making sure that it was SEO optimized.
Yeah, and we had Annie as well. Annie was
that's right.
writer, so we'd pay one of our dietitians
to write a regular blog. So yeah, we'd actually do a weekly blog, I'm pretty sure. We paid her for a number of ones to write. So if writing's not your forte, you could think about hiring someone and getting them to do a package of 10 or 20 blogs that you could easily upload to your website.
Look, I think with AI now,
yeah, you probably just do it
you can do a blog a day. The key thing with AI, though, some people see it as cheating, but For me, I'll use AI to give me the foundation of a blog, and then I'll still spend 20 to 30 minutes
Refining
tuning
it.
and adding personal touches, and it's just giving me the structure. And then obviously you've always got to validate some of the stuff that AI spits out at you as well. You've got to make sure
Yeah.
it's what you would actually say and that it's evidence-based, but it certainly really helps to craft the structure and it makes it so much easier. So in turn, blogs is just a no-brainer, and particularly when you just ask it to do SEO optimized blogs, put that in your prompts, say, I need you to act like a world-leading copywriter. I need an SEO optimized blog on blah, blah, blah.
Yes.
Give it plenty of detail. But yeah, definitely an optimized blog with some call to actions to go book an appointment or download your free ebook, collect their email. So again, we talked about Kajabi on here before, but using like some sort of tool like Kajabi where you're collecting their email for a free gift that you're giving them as a result of that reading that blog. So it's like a call to action as part of that.
Yeah. And you can put those on Facebook and Instagram ads as well. If you post about your blog on Facebook and Instagram and then no one sees that post, you could turn that post into ads, show new people, they see the ad, and then they click through to your website.
Stacey has her own business, staceyhughes.co. So you actually honed your craft on our business. So you did Facebook ads and meta ads through our business, and that was able to grow our following quite substantially through ads.
I would concentrate now more on the lead form ad. So the form on Facebook and Instagram, there's been a lot of changes with or things to make better in that space around lead form ads. So I would do that.
But just explain that just so that you're capturing their details.
So that you're capturing their name and email. So you either deliver something of value. So on the last page of the form, they can download something. So maybe it might be the 5 things you need to buy at the supermarket to lose weight or something like that, some sort of checklist or downloadable. But you've got their name and email. Or I would, like brand awareness type ones, but using the lead form. So get their name and email and maybe a bit more information. Ask them some qualifying questions like, are you interested in seeing a dietitian or something like that. And then nurturing them on email once you've got that name and email and just explaining about the process of seeing a dietitian, how much it costs, that type of thing.
One of the best marketing tools that we used was the postcard. You remember the
postcards. I totally forgot about this until you reminded me about the postcards.
We would get 300 odd referrals a week. We had quite a big business and we'd get quite a few referrals. And these are care plans mostly, or DVA or whatever it may be. Some of those referrals, I forget what the percentage was, but maybe 10, 20% never acted on it. Stace come up with an idea, and there's a business out there where you could actually do all this online, put in the client's address. It would send them a postcard that you've created the copy for, and we would offer an incentive to come for their first appointment. It might be a free meal plan or something to that effect. I remember the return on investment. I think the postcards posted out, all printed and everything, were about $1 or $2 each, which might sound expensive, but we would send out maybe 1,000 or something, but it would be more than a $30 return. So for every dollar we invested, we were getting $30 back. And that was, I do remember we were only measuring that on the initial metric of first appointment. So that wasn't counting whether that person come back 2, 3, 4 times.
Yeah.
So it was such a great marketing strategy that I, again, was skeptical about, but it paid off. It was huge because no one gets mail anymore.
No, but it was something we got our VAs to do because we would download the data, the people's names and emails and how many visits they had left that were unused, but we'd put it into an online program and that program would send the postcards. So that was worth it.
So maybe when we added up the time, it was more than $1.
Yeah, but still, I think whatever it was, we worked out it was well worth it. And we only knew that from collecting that data of what we'd received, how many people then came for their appointments. Yeah. So we were emailing and texting and calling them, but then they also received a postcard as well. So that was worth
so many touch points.
There's so many touch points. And that's Google. Everyone's coming out now that people need 20 touch points before they purchase with someone. So that obviously might be different when they've got a chronic disease and they have to come for the appointment, but still it's just that principle about the different touch points. and being again in the front of people's minds.
20, well, yeah, that's a lot. Okay. It's a full-time job, marketing. Now, we had a huge email list, and we've said on this podcast before, we didn't probably utilize it to the best of our ability.
Yeah.
But there was times where we did, and certainly I think now that you're talking about 20 touch points, having some sort of like email sequence once they opt into. So let's say they have downloaded a free lead magnet, checklist, recipe ebook, that it then qualifies them for a email sequence. And it might be an email sequence on diet modifications to enhance bone strength or something. And then they get an email every day for a week that provides really value nutrition-based tips that, is going to help them. So I think something like that, once you've set it up, is low cost, and it just adds to those touch points, doesn't it?
Yes, definitely.
We also used to do like a recipe videos. So we used to do a recipe series, didn't we? We'd put recipes together. They were always popular, but it was a time-consuming exercise.
It was time-consuming. And you bought equipment and set up your phone and cameras to record it. And then, that was time-consuming. We would remember we used to do cooking classes as well. So we'd get people in to learn how to cook, basically. And we just do really basic recipes, but they were really popular as well.
They were. Maybe we always charged for the cost of food. We made it really cheap.
Yes, like $20 or something, maybe.
And you get a good uptake from it, which was great. We made sure all of our offices were set up with cooking facilities. Health expos, they're always really hard though, weren't they? Like you never really know what your return on investment is. And that doesn't mean they don't work. When the NDIS was established, we went to a number of health expos.
They're always on a weekend, so that sometimes was tricky. Like it's a whole day on a weekend. Hard to gauge whether the return on investment was, but probably in terms of brand awareness and getting people familiar with what a dietitian does, that was helpful.
The NDIS expos, we certainly got business from, but just with all the tools out there now where you can measure your metrics and return on investment, things like that, where it's difficult to measure. It's hard to say how successful they were, but
especially if you did have to pay for your site too. Because sometimes, remember there was some that were like $500 for your site. So
if you put $500 into ads,
you might get a better return.
It's hard to say, isn't it? Same with sponsoring local sports teams or events. It's good from a generosity, local community spirit aspect, but I just don't think we ever got a return or any feedback from it. If you get your brand on the back of a shirt that no one notices, I don't want to deter anyone from sponsoring their local footy team, but I think we ever got a huge return from that.
It's more just goodwill, things like that, isn't it?
What about Google My Business? We were pretty good with Google My Business.
Yeah, Google My Business is still a very strong marketing tactic even today. And we used to have our VAs post on there regularly. So I would recommend people still do that. Yeah. And I use it in my business to collect testimonials, but I know we didn't do that for CQ Nutrition.
Yes. So testimonials, I understand why we can't use testimonials. For anyone that is a nutrition professional that's not regulated in their profession, they probably can use testimonials, but certainly dietitians, being a regulated profession, can't use them. And they can't for the reason they could be manipulated, which ultimately could influence someone's decision to engage your services, which could be misleading, it's a real shame because word of mouth, that testimonial or other users' experience is one of the most powerful forms of marketing, isn't it, Stace?
Yeah, definitely.
So it's a tough one, but if you go to the Apple website, there's a few things with it, okay? So a testimonial that you've got no control over, so it's testimonials in advertising, essentially. So as long as if you've got no control over it on your Google page or on a review page or whatever it is, and they've done it, they've found it, and you've got no control over that, that's
so okay. That would be Google My Business because they could review you on Google.
Yes, but you don't want to be sharing.
You can't send it out.
Yes, so they've got to do that independently. You can't manipulate the review, or you can't do it anyway on Google My Business. I don't think. But as long you can't take clips out and edit it. But you can use a testimonial. There is ways you can use testimonials if they're not talking about clinical outcomes. So if they're talking about the friendliness of your staff or the ease of making an appointment or their experience with the service, as long as it's not related to the clinical outcome side of it. So there are ways you can use them, but yeah, you just got to be very careful if you're a regulated profession. Yeah.
And what would be the worst case scenario?
Are you flaunting the law?
No, I'm just asking what would be. I'm just want to know. Will you lose your license?
Oh, I'd imagine there'd be a
They burn
warning.
your practice down. What do they
You got to do the right thing. Now, one of our best marketing tools was a health challenge.
do? 30-day health challenge.
Yeah, now these, you could do smaller versions of this. That was pretty extreme in the end. Like we put up a big prize money and it was really about people doing a nutrition course. But social media following tripled over the space of probably 2 years.
And we probably invested the most we ever invested in ads. We did do for the health challenge, but that also increased our list quite significantly every time we ran the health challenge.
Yeah. Yeah. So that if you've got a niche, you could do a challenge. It doesn't have to be over the top, but it's just gives people something to take part in. And they get to know you and they're engaged in it. And so it was a really useful process for us. So I would recommend that highly. Like it can be done quite well. It doesn't have to be too commercial in nature, but it certainly can be done and provide value to people. So yeah, it was great for us.
And even we would do smaller versions of that. And I think during COVID as well, when we weren't able to do the in-person things, was like a 7-day reset or a 30-day reset or something like that. We used to have a tangible 7-day reset book that we would sell or have in our clinics. So yeah, that was something that you could just do a smaller scale down version of that type of thing.
Also, something that we did towards the end was a podcast. And there's also advertising on Spotify too, another avenue, but having your own podcast or going on other people's podcasts, right? If you're working in the online space, I think it's quite useful. From a local aspect, I used to have a weekly spot on the local radio, ABC, and that was hugely successful for us from a local standpoint. If I was more online, I would just focus on a podcast, so a broader audience nationally or internationally, whatever you want to do. But then locally, yeah, that local radio gig was huge for us because.
And we would even like really amplify it with our social media content too. So we would say things like, make sure you tune in on Wednesday to listen to Chris Hughes on that segment on the ABC. And then once you would do it, we would put it on social media as well as a recording and things like that. So we really amplified that content.
But it also gave us content.
Yeah.
We could repurpose that content. I had to come up with content every week.
Yeah.
And quite often it was research-based or it might have been theme-based, Dietitian's Week or
Christmas or...
Christmas, whatever it was. But otherwise it was research updates. And yeah, it was great, wasn't it? Like in terms of the content it gave us, like it was such a good tool. Another thing we did was a Facebook group.
Oh, yes. We still have that Facebook group today.
So that's quite useful because you've got a captured audience. Obviously, they don't see every single post, but it's a good way to collect like-minded people so you know what they're in there for. So we found that quite useful and built that up over the time we had it. And then also doing lives on Facebook was quite good. So I remember there was a period there where lives were new, and so they would get a lot more reach. And so Stacey would have a gun to my head and I'd have to be on Facebook doing lives all the time. It's probably where I become, I wouldn't say confident, but accepted the fact that I had to get in front of a camera, even with a head like this. And so we'd jump on and do Q&As. And so I think that's a really good tool locally as well, because you can promote that, couldn't you? You could promote that locally, that there's a webinar or whatever coming up and people could engage with.
Yeah. And even you could do a regular segment or something like a show or something like that, like once a week, maybe every Wednesday, or come up with a catchy title or something. That is something you could introduce like today, which would be quite effective. You could do it on any of the platforms where you do like a regular segment. Yeah.
Remember you and I used to do product reviews.
Oh, that's right. Product reviews. Yeah.
You used to ask me.
I'd buy some things at the supermarket and say, are these good or not? Yeah, that was really good. We should get back into doing those.
Yeah, you'd buy them and I'd eat them and do a review after I've eaten them. Yeah.
People loved them. They really did.
Yeah. So with that then, so let's say you're putting money behind a Facebook ad for lives, some sort of regular feature. The retargeting ads you can set up from that as well, because we used to use that.
Yeah, so retargeting is just people that have engaged with you. So the more people you get engaging with you in any way, going to your website, on Instagram, on Facebook, watching your videos, watching your reels, commenting, liking, sharing, saving your posts, or any of those things, you can retarget those people.
What if they've just viewed it? Have they actually got to like it?
They don't have to like it. They can just go show more, even if they just paused on it.
Okay.
Facebook Meta knows that. But if they did, the show more and they read more of the caption, any type of engagement at all is captured by Meta, and that's a signal that's a person that's interested in your content.
Well, we remember we had, and we've spoken about this on this podcast, is we built an online calculator, like a calorie calculator.
Yes.
We would capture email. So it's a good lead magnet tool, but the retargeting would have,
Yeah, because you're sending people to your websites. So we would retarget those people as well. Yeah.
yeah, and that was quite useful then too, because it
Yeah,
helps with the SEO and everything as well, doesn't it?
it does. Yes.
So some sort of online quiz would be quite useful. Online calculator, they're really
Yeah.
easy to build. If you need help, yell out. I'm happy to help someone, but they're pretty simple to build, and particularly now with AI, you can build them quite easily. Now, also we would do, this is probably the last of the things that we would do. I can't think of too much else that we did, but like awareness day campaigns. So you just tap into whatever, and this is a bit hard to stay on top of because every day or every week it's international.
Or something.
But just staying in tune with that and using that as part of your content strategy.
This would really help with you for free PR as well, because often it would be the local radio state or local TV stations that would ring you up on New Year's Day or things like that. And you get a bit of free PR from being active for these types of things. I can't remember any other ones, but yeah, probably Celiac's week or something like that. Maybe you got some free PR that week.
I remember I wrote a blog that went viral about those drinks and I was on Mamma Mia.
Yes, those
What are they
sport,
called?
I can't remember what they were called now. The
The
strength, the prime drink. So
Lime.
yeah, finding that topical
Mm.
topic that's big in the news and then leveraging that and trying to get in the media.
Yeah, yeah. So that one was on Mealzee. That was when we didn't have we'd sold Seek Nutrition by then. I still get like hundreds of views on that.
Yeah,
Yeah.
amazing.
A lot of our traffic coming from the US. Okay, so they're the things we did. What we didn't do that I'd probably use now was Google Ads.
Mhm.
What are your thoughts on putting money behind Google Ads?
Yeah, learning Google Ads, I'd probably learn that myself and do it because, yeah, it probably wouldn't be that cost effective to hire an agency to do your Google search ads. But yeah, definitely spending some time investing in learning that and putting some money into it would be great.
I've seen a lot of people do discovery calls, like free
Mm.
15-minute discovery calls. And look, that obviously works for people if they keep doing it. For me, bulk billing appointments, Medicare appointments can be a bit of a discovery call if you're quite clear on what that first appointment is. It's a collection of information and a rapport building session. You might as well get paid for it, is my theory around that. Certainly, that is an option for a lot of people. I know it's certainly big in the States where they do discovery calls. I think if you've got something like Medicare, it can act as a bit of a discovery call process.
Yeah, I think that, yeah, that's a lot of time. I know I use it for my business, but it can be quite exhausting when you're on Zoom all day doing free 15-minute discovery calls.
I understand it for a business like yours where the packages are higher cost.
Yeah.
Like if you're charging $100 or $200 for a consult, which is going to be 30 to 60 minutes, and you're giving away 15 minutes for free on top of that, I don't see that as good value. But anyway, some people use it and good on them and must be working for them. Something that I would do moving forward is really target that corporate wellness space.
Yes.
And that's something that fell in our lap, but we didn't really go after that. But I would be going out, seeing how I could work with corporate partners about offering services and value to their employees from a nutrition standpoint.
Yeah, definitely LinkedIn. That would be a space to really promote those services that you have.
Yeah, absolutely. Yeah, yeah. You can put programs together. Certainly the recipe ebooks with Mealzee, again, I'll give that another plug, but that's a pretty cool feature in terms of you can collect the emails of the clientele. They get a free recipe ebook, and then within that recipe ebook, a little web page on your services and what you can offer. little buttons where they could book an appointment or book a call or whatever it may be. So yeah, certainly that is something that we do. I've said earlier, we didn't really nurture our email list, but you could do that with SMS or WhatsApp or Messenger now, where people opt in and you just do a tip of the week or a recipe of the week, where you're just keeping that relationship nurturing over time, couldn't you?
Yeah, definitely. We did use SMS a fair bit. Obviously,
Use it
yeah,
for the marketing tool,
yeah,
did we?
not consistent one. We probably used it for one-off strategies, or if months like April, where it's a really hard month income-wise because of all the public holidays and staff off and things like that, I think we would use SMS in times like that.
Yeah, and I suppose you've got to be careful too with SMS.
People can opt out.
Yeah.
But it's not to make it easy for them to opt out. That's the only condition there.
To make it not annoying too. They might like the first tip, but then get the shits with the rest. You'd be conscious about it. But WhatsApp and Messenger and that, I think it would be quite useful. Email certainly still there.
I really like the idea of an online workshop series. I think that's, a lot of people say webinars are dead, but I really don't think so. It just creates that human connection.
Would you do it for free?
Yeah, I would do it for free. Run ads to it, get people to register, have some type of call to action at the end of it.
Yeah, just keep it nice and simple though.
Simple and short. We don't want people to, especially if you're doing it at nighttime when people are tired, keep it short.
And it wouldn't even have to be a 3-part. You could do it in a 1-part, couldn't you?
Yeah, you could just do a one webinar. Yeah, one webinar, getting in front of the camera, talking about your topic, creating that human connection, and then giving them a call to action at the end.
All of this is marketing and attracting new clients. But, you know, if you've been in the business for a while, think about how can you leverage more business from your existing client, because it's 5 times cheaper, or they say 5 to 25 times cheaper to get more business from an existing client than it is to go and chase a new client.
Yeah, that's right.
So, you know, whether it was referrals or you're marketing to your existing client base to come back again and access more services.
Yeah, I guess things to focus on your new customers, your new clients, growing your list, and then what you do, your marketing activities to your existing clients.
There's a fair bit there. Like when we thought about this for a podcast episode, I'm like, oh, is there enough to talk about? But there's probably, between the two, there's a good 50 odd tools.
Strategies there, yeah.
So there's certainly enough you could use. Hopefully, if you've listened to this, you can get plenty of value out of that. And
yeah, let us know on Instagram what your favorite one is and what one you're going to implement.
And if you're interested in the recipe ebooks for Mealzee, I'll give that a plug. They're yellow out. I'll give you a demo just to show you the automated ebooks, because once you set them up, the clients fill out the form. It's all hands off. You actually don't have to do anything, and it just produces customized recipe ebooks that have your business features and buttons and stuff in it that you can help promote your business. All right, thanks, Stace. Thanks for your time.
No worries, my pleasure.
Appreciate you giving it up.
I do. Thank you, and talk soon.
Do you find this podcast valuable? There may be other nutrition professionals out there will also. If you like, share, and subscribe, it's going to help other nutrition professionals make an impact on the world, just like you. Thanks.